Welcome to the Skin of Color Savvy, the art and science of treating patients of color, the official podcast of the Skin of Color Society, produced by HCP Live and hosted by SOX leaders. Skin of Color Savvy delves into the latest research, clinical insights, and culturally intelligent and responsive care practices in dermatology with leading experts. I am Dr. Rebecca Vasquez, an associate professor of dermatology at UT Southwestern, where I'm also the director of the Vitiligo and Pigmentation Clinic, as well as community engagement. And it is my pleasure today to be joined by Dr. Adamson. I'll give Dr. Adamson a chance to introduce himself, but before that, I want to introduce the topic for today's episode, UV safety in patients with skin of color. Dr. Adamson, I'm very pleased to have you as our guest. Could you please introduce yourself to the audience?
Yeah, thank you so much for that introduction. What the audience may not know is that Dr. Vasquez and I were co-residents together at UT Southwestern. So I'm so excited that I get to share the podcast stage with her. She was a lifeline for me in residency. Residency was tough, and she was always there studying with me, getting through all those exams. And so I want to make sure I shout her out in public and give her flowers. So I am a assistant professor. I'll be an associate professor starting in September in the Department of Internal Medicine in the Division of Dermatology at UT Austin in Texas. And I run the pigmented lesion and melanoma clinic at our institution. And I do about 80% of my time is dedicated to research. And I see patients only about 1 day per week. And my focus is on skin cancer and how we deliver care to patients that are underserved, as well as how we might be treating patients too much. And we'll see how much of that we'll cover today. But I'm happy to be here on the podcast.
Wonderful. Thank you so much, Dr. Addison, again for being here and for that kind comment. You were my lifeline as well, I have to say. And so we'll go ahead and jump in. And it's going to get hot and heavy. All right. So
I'm
there is
aware there's controversy in this
it-
space.
there's controversy in this space, and I think you're the perfect person to help kind of unravel the mysteries around UV and skin of color. So there's this persistent myth that patients with skin of color aren't at risk for UV damage. What should clinicians keep in mind when educating patients about UV exposure?
Right. So ultraviolet radiation can damage skin of any melanin concentration, whether you're super light from your ancestry, say maybe from Northern Europe, or you have ancestry from Central or Western Africa and you are richly pigmented. There is a threshold at which a lot of sun can cause damage. Now, what that damage ultimately results in, I would say, differs depending on your degree of pigmentation and as well as your ancestry.
Absolutely. Are there any concerning trends you've observed in patients' perceptions that you feel clinicians should address related to this topic?
So I do agree with what you said at the top that there's a myth that folks with skin of color can't sustain UV damage. And I am a proponent for people to make sure that they try to avoid getting sunburned, right? Because you can get a lot of pigmentary alterations and changes and accelerate skin aging as a
Mhm.
result of not taking care of your skin or allowing it too much sun exposure. But I also think that we need to be measured in those recommendations in darker skin types. And we shouldn't make people feel so fearful about the sun that they can't enjoy going out for activities or feel bad about not wearing sunscreen every day or reapplying rain or shine, whether they're inside a box or, or not. I mean, I think sometimes we can get a little bit extreme.
I agree. And I just kind of wanted to add to that. I get a lot of, I work with a lot of medical students and they're all about like these sunscreen campaigns, right? And I'm like, there's more to it than just sunscreen. It's not a one fix, and I think it's important for us to also have conversations with patients about the risk factors, right? What are other risk factors that go into UV damage that can lead to complications, whether it's, pigmentary disorders or whether we're talking about skin cancer. You talked already about your ancestry and the gradation of skin tone that can, that damage can happen on a spectrum depending on where you fall, on that skin tone, right? Certainly, are you immunosuppressed? Do you have a family history? I think that these risk factors aren't talked enough with patients, aren't publicized enough so that they know, okay, you know what, I have a family history. I take medications that make me more photosensitive. I'm in an occupation where I'm also, constantly exposed. Maybe I burn a little bit more easily. Those are things that I think we don't talk about enough that I think patients should be aware of, and they can actually practice. It's part of what we should do is patient-centered care, right? Not just saying here this is a one size fix for all. And I think sometimes when we do that, that can sometimes play into the disparities that we see.
Yeah,
Um,
I agree with you, Sam. I mean, uh, we often only preach the gospel of sunscreen, and we don't talk about other measures like seeking shade or wearing UV protective clothing, a hat, trying to
Absolutely.
avoid certain activities during certain parts of the day. It's not just about sunscreen, you know.
Absolutely. Absolutely. There is, and tell me kind of what you think about this. Like when someone talks to you about maybe melasma or even post-inflammatory hyperpigmentation, does that shift your conversation about photoprotection in any way?
Of course, it
Mhm.
makes me even more apt to recommend that they practice sun safety, right? With sunscreens or hats or other things that I just discussed to make sure they don't exacerbate those pigmentary problems.
Yeah.
And I'm
And
sure you do the same with your patients as well.
yeah, no, I preach the gospel there. That's where I preach the importance of sunscreen, and I try to frame it, and I think we'll talk a little bit about this later, but as an investment in their skin now. Even with my patients who are, coming in and they're young, I tell them, photo aging can look different again depending on your skin tone over time. And sometimes it can show up as discoloration. So it's really about investing in your skin now so that you don't have to kind of, spend too much, work too much in the future to kind of maintain that balanced skin tone. So, yeah, I definitely have conversations about that frequently. All right. What are
The
some?
other thing I would also say though, speaking of investment, because investing is hard. It's hard
It
for
is.
people to, like financially too, as well as in your skin, because it's the daily grind of, every single day really worrying and thinking about it.
Mhm.
And starting those habits early are what really will help, and just like investing financially will help in the future. But what I try to do in the patient room, at least, is also acknowledge how difficult it is,
Yep.
and I also try not to shame people who may not always get it right. And I think that that goes a long way with building trust with patients. Is yes, talking about these risk factors and behavioral changes, but not to the degree that you make people feel, ashamed of their, behavior.
You're absolutely right. I have patients who come in and they're like, they're already apologizing to me. I'm so sorry. I haven't been doing my sunscreen. I know I should do it. I'm like, hey, I was like, life is hard. I'm not here to judge. I was like, I'm just here to give you my recommendations. I know it's a day-to-day thing that you have to do. I try to give them tips like, things that help me remember. It's the first thing that goes on after I brush my teeth. But like, I'm not gonna, make you feel bad about it. I think you're right. I think patients come in and feel real guilty. Like, I almost didn't come in today because I haven't been doing my regimen. I'm like, what? That's not a reason to come in. I'm not gonna get mad at you. So I'm so happy that you touched on that. Um, What are some key considerations when recommending sunscreens or photoprotective strategies to patients with skin of color?
I think that they're very similar to recommendations you offer to patients of all skin tones. Broad spectrum coverage, um, SPF of 30 or above. I often tell people go with 50 because usually they don't use it at the concentration that it was tested in the lab. And so if perhaps don't put on enough, you still got an SPF that covers you to a degree that is good.
Absolutely.
And I know
Well,
there's a lot of folks that like to talk about tinted sunscreen. That is also something that is an option for some folks that have more melanin-rich skin that may look more cosmetically favorable. I don't know if we're going to get into a discussion about chemical versus physical, organic, or sunscreens
absolutely. You
and
want
all
to
of
touch
that
on it?
controversy. And I don't know what are there any recommendations you give to patients beyond that or specific to folks of darker skin types?
I do a lot. I will say, I will admit, and I'd love to hear your thoughts on that, but on this, but I do recommend, especially for patients that I see with hyperpigmentation, I definitely want to make sure that they're using a broad spectrum with UVA coverage because I know we know that that's important in hyperpigmentation as well as photoaging, but iron oxide as well. And it's because of that visible light, right? That's
Hmm.
probably a little bit more prevalent than even UV when it comes to all the sunlight. And so I will usually try to encourage them to use a tinted sunscreen. I think the challenge is that, I think we're getting better. I think we're getting better, but the challenge is, ensuring that they can find a color that matches their skin tone. And so I think a lot of products right now are trying to increase the number of different shades for tinted sunscreens. Some are better than others, I think, but I do think that if they can do it, I do think it's important that they add that to their regimen, just given how difficult it is to really undo some of the photo damage that leads to that hyperpigmentation.
Yeah, color matching is definitely a problem. And
Mhm.
honestly, it's chemical sunscreens that are more cosmetically elegant and are probably the ones that folks with darker skin will be able to tolerate aesthetically, on their skin, so they don't look like a ghost, ashen.
Mm-hmm. Mm-hmm. And and that's I think some of the barriers that we currently face is if I have to be honest, part of what takes me time is kind of going through our samples and trying out with the patient then and there. Let's see which one fits, which one would you like to use? And then, trying to go over those options with them before they leave so that they feel like they are empowered to kind of look for something that works for their skin. Are there any particular products that you found acceptable for, some of the patients that you see, formulations or products?
I usually try not to wade into recommending specific products, mostly because I've been burned many times. Patients will come back, you recommended X product, and like it felt awful, or I felt greasy, or I was looking pasty, and I said, well, you know, sorry, but everyone's skin reacts a bit differently to various products, and like I said, as long as they meet the criteria that I said in terms of SPF, broad coverage, and if they're going to be doing sweating a lot or doing stuff in the water, water resistant, if they meet those criteria, go with it. Go with it. In our office, we have like a sheet we give folks on sun safety where we have various different brands that are very popular, whether it's Neutrogena or Supergoop or Banana Boat or all of those different kind of. They don't pay me, by the way, but those are examples of different products. I don't know if there are certain ones that you find, that are good.
I'm with you, Dr. Adamson. I try not to recommend either because I just want them to use something that they are going to feel comfortable applying every day. So what I might do is say something like, okay, do you want like a glossy, refreshed look? Do you want more of a matte look? And I'll kind of tell them, there are, and the same thing, we have a sheet and we provide them with a sheet with all these different kind of sunscreens. And I say, you'll find that this one has more of a milky liquid solution. This one has more of a matte finish. So it depends on what they want. I also think the price point is really important, right? Because we talked about investing, that can be expensive. I don't know why sunscreens are so expensive. But they really are, especially the more kind of cosmetically aesthetic. It's like, oh my gosh, it's like you have to like. And so I tell them, I was like, look, really, if you're going to invest in good sunscreen, use it in the areas where maybe you don't really want to get worsening of that hyperpigmentation. So on the face, and maybe get something a little bit less costly to use on the rest of your body, But I do think that trying to be creative and help them reach goal is something that I try to spend some time with. But I think it depends on the cost, on their needs. And I'm with you. I'm like, I really don't care as long as it meets the UVA. If it has the tinted sunscreen, that's a plus. And if you're using enough of it, I mean, I'm happy, And if you're able to access it on a regular basis, amazing. Okay, so I think now we're going to touch a little bit on research and representation in UV studies. What do we know about UV risk in skin of color that's evidence-based? And what more is there to explore given the lack of representation of patients with skin of color in clinical trials?
So it depends what you mean. Do you mean on like skin cancer related outcomes, or do you mean in hyperpigmentation, or do you like what what type of research are you referring to? Because I want to make sure I answer your question the way you're interested in.
I would like to focus, I think. I think this can go either way. I think we should kind of talk a little bit about skin cancer.
Okay. Well, I've done a lot of work in this space.
Exactly.
You know? So let's take melanoma. Um, so my research group, we decided to do a what's called a systematic review, where we took all the literature that has been written about the association between UV exposure and melanoma. Is there a relationship, right? Because melanoma is a type of skin cancer that's potentially lethal. It's the it is the skin cancer that causes the highest number of deaths in the United States. And it is well known that UV exposure is associated with melanoma. But what I wanted to know is that true across racial and ethnic groups? And what I found was there really is no association between UV exposure and melanoma in any group except people that identify as non-Hispanic white. Not in people with Asian ancestry, African ancestry, even in Latin America. Look at all the studies, and on balance, there's no association, right? And so I get really upset when people on social media like to say you should photo protect, put on your sunscreen, etc., because you will die of skin cancer or you will get skin cancer or melanoma, because that simply isn't true. There's no data to support that. And it gets back to this idea of fear mongering and exaggerating, which I think is bad for patient care. And so my research really has shown that UV exposure and its relationship to skin cancer is a little bit different, in folks that don't identify as non-Hispanic white, people that have, more melanin, etc. And let me pause there. I have a little bit more to say, but let me pause there to see if you have any reaction.
No, and I'm glad you touched on that because I've actually my second and I'm and my second follow-up question would be, so how do you Do you counsel? Do you counsel your patients with, or those who self-report to be other than non-Hispanic white? How do you talk to them about melanoma specifically?
Yeah. So, in folks of color, what I tell them is they're at risk of developing melanoma. Um, Anyone can potentially develop it. They're just at way lower risk. Like, depending on your race or ethnicity, up to 30 or 40 times less likely to develop it. And so I tell them that, if they're going to develop it, usually where you'll find it is on the palms, the soles, right? Acromelanoma, famously, Bob Marley passed away at an early age from a melanoma that was on his foot. I believe it was on his toe. But again, when was the last time you saw a toe that had a sunburn on it, right? Um, and so so that's usually how I counsel patients. And that photoprotection in skin of color is largely for hyperpigmentation, the avoidance of sunburns, which are also uncomfortable, premature aging, exacerbation of photosensitive disorders, like say lupus as an example. But it's not for cancer prevention, right? And that's fine. That's absolutely fine. I'm not saying don't wear sunscreen, but I want you to be aware what reasons why you're actually wearing it. And the public health message actually being honest and not overstated.
And I think you touch on something that's really, I think, also important to me is providing that false sense of assurance when we tell patients, use your sunscreen because that's going to help you, and you forget to counsel them on, wait a minute, your risk of melanoma is actually in areas outside of sun protective measures. And we don't talk about that enough. We don't know about the risk factors about that enough. And so what it just do is just, you're not having conversations about it. You're
Mm-hmm.
not putting resources into studying it. And it's so challenging to talk to patients because they're like, well, why am I more at risk for getting a cancer on my hands and my feet? And I'm like, I don't know
Mm-hmm.
because we just haven't gone there yet. I
Mm-hmm.
can guess that some people have a history of infection or trauma, but we just don't know yet.
Yeah,
So
we're not
I
sure.
think I think it's important to be able to have um, these conversations, these real authentic conversations, so that patients can have and be empowered to know how to best take care of their skin, knowing what to look for, where to look. And sunscreen is okay, but it's not the end all be all. And we're providing a false sense of I think, assurance when we say, use this. Now, talk to me a little bit about your thoughts on non-melanoma skin cancer in patients with skin of color.
Mm-hmm. Yeah, so we also did follow-up study looking at this question in non-melanoma skin cancer or keratinocyte carcinoma, basal cells and squamous cells. And what we found was that there, for patients of African ancestry, there's actually just no data. There's like zero data,
Mm.
none, right? As showing showing any association at all, or really even the attempt to look at it. However, in East Asian populations, there is some inconsistent evidence that points to there potentially being an association. But that association is really weak and highly variable depending on whether you're male, female, um, age-wise, older, younger. And what I would say is that we should be cautious and say perhaps there may be something here, but it's by far from definitive.
What about I know that for squamous cell carcinomas, the
Hmm.
evidence for UV is kind of similar, somewhat to melanoma,
Hmm.
in terms of it being a risk factor. But I will say, being in Texas, a
Hmm.
large Hispanic Latina population, we do see a lot of pigmented basal cell, and it could be related to, again, the occupation of a lot of my patients who
Hmm.
tend to work outdoors, their ancestry, and their baseline skin tone.
Hmm.
But I think there is a relationship, right? A
Hmm.
very more a more studied relationship between BZZs and ultraviolet light?
Well, yes, I would say in the Hispanic population,
Mm-hmm.
there aren't a lot of large studies looking at this. And when we talk about lack of representation or um, uh, areas of understudy, this is one of them. Keratinocyte carcinomas, for
Mm-hmm.
sure. I would say that is true. Um, and Part of the reason why is we don't usually capture these cancers in cancer registries like we do melanoma,
Right.
right? So it's a lot more difficult to really study them at the level that you need to get um, to get definitive or more definitive answers.
What do we know about UV risk in skin of color that's evidence-based, and what more is there to explore given the lack of representation of patients with skin of color in clinical trials?
For sure. I mean, because what we've been talking about for a majority of the podcast has been prevention, which
Mhm.
is only which is our primary prevention, which is only one aspect of prevention. You got also secondary and tertiary prevention, and social determinants of health play a big part, especially in tertiary prevention in the receipt of high quality, high value care. Um, and also the ability of patients as well as physicians to recognize skin cancers, which may look a bit different in darker skin types. And I talked about this at the SOC Scientific Conference. Artificial intelligence that is empowered to actually help with early detection as well could be an issue in the future. And so representation, I would say, is really important in order to make sure people get, you know, equitable care.
And we're getting close to closing time. What is the Skin of Color Society working on to fill in some of these research and educational gaps? I think what they're working on doing is continuing to find opportunities to fund research that really focuses on some of these disparities that we talked about. You can also find on the education side, if you just kind of, I would encourage you to take a look at the Skin of Color Society website. You'll find workshops, recorded lectures on how can we recognize skin conditions, including skin cancer, pigmentary disorders across skin tones. And one thing that I'm very passionate about is building the pathway to become a future leader in this space. And I think Skin of Color is also doing a great job on providing networking opportunities and resources to build that pathway. If you could give one or two practical pieces of advice to clinicians seeing patients with skin of color this summer, what would it be?
Make sure that you emphasize photoprotection, but photoprotection not for cancer prevention, but for the prevention of all the other things that may result, like premature aging, maybe sunburns, um, exacerbating photo sensitive disorders. But please, please don't tell them it's for cancer prevention because that's just not true.
And to piggyback off of you, Dr. Adamson, I think it's important to be proactive in conversations about sun protection. Do not assume that your patients, whether it's patients with skin of color or just your patients in general, know about these risks. So have these honest conversations. You need to tell them we don't know enough about skin cancer in patients with skin of color. What we know now, there's not enough evidence to suggest it for skin cancer, but we know that it's really important in photoaging. We know that it's important in pigmentary disorders. And doing your best as to again try to invest in your skin where possible to prevent later, I hate to say complications, but changes in your skin that lead to imbalances that you have to kind of address, and sometimes it can be a little bit more challenging to address. One more point, Dr. Adamson, that you want to leave clinicians with patients with skin of color this summer. One more maybe clinical pearl.
So I say this all the time for people that go to the beach. Um, One, don't put your sunscreen in your car and leave it there. It's going to degrade the active ingredients. Instead, what you should do is you should put it in the cooler. And so when it's time to reapply, Not only is it safe from degradation, but it also feels nice and cool when you put it on the skin.
Oh my gosh, I'm gonna steal that. Oh, I love it. Oh my gosh, I'm the person that puts it in my car. So you're speaking to me right now. Oh, I love that. Awesome. Well, thank you so much, Dr. Adamson. I know you could be anywhere today, but I appreciate you spending your morning with us, or spending your time with us. And I want to thank you for having this insightful, authentic, and engaging conversation. I hope this is the first of many for us in the future. And so I hope that everyone else in the audience found this engaging and insightful. But this wraps up the Skin of Color Savvy episode with Dr. Adamson. Thank you so much to everyone for your time. We hope that you found today's discussion informative and inspiring. If you are interested in learning more about the Skin of Color Society and its impactful work, I encourage you to visit skinofcolorsociety.org. Please don't forget to subscribe to HCP's live newsletter and follow on social media to stay up to date on the latest in dermatology and more. We will be back with another episode, so be sure to subscribe to the Skin of Color Savvy on your favorite podcast platform. Until next time, take care and thank you for listening.